today our topic is superficial mycosis. So, uh, first of all, I want to say that apart from bacteriology, virology, parasitology, fungus is very small portion you have to know. The basic of fungus, what are the types of fungus, because you have been asked in Viva and the short note and might be long question will come. So, what are the important topics of fungus? First of all, that Viva, what are the different types of fungus? Classification of fungus is very important. Name some yeast, name some yeast like, what are the molds? Okay, so these are the basic question you has been asked in Viva. Everyone, and you have to know with examples what is the difference between yeast, true yeast and yeast like organisms. What is dimorphic fungi? Name some dimorphic fungi. So, there are the main 4 types of fungi. One is the yeast, yeast like, mold and dimorphic fungi. These are the 4 basics, right? And apart from that, there has been questions, might be long questions come from Cryptococcus, that is a true yeast, Cryptococcus meningitis, and another is a Candida. These 2 are the main important topic from yeast and yeast like. Just you have to know both, just 2 organisms and their related clinical questions. Cryptococcus do what? Meningitis. Candida do many things. Candida, candidemia, it is a sepsis. Bloods in Candida is called candidemia, right? Candida cause also some skin infections, superficial and also deep seated infections. And then molds. In mold part, today our topic is important, that is superficial mycosis, because you have been, when you have become a doctor, you have been daily basis a case of khujli, itching, right? Ring like lesions, itch guard, you have seen the word, right? Ad commonly we have seen, huh? The ring like lesions, have you have been seen ring like lesions, red patchy ring like lesions. So, this is all about, that is tinea, okay, and it is very mistreated by quacks because everyone gives steroid cream. When patients come to your clinic having a itching, if it is a kind of dermatitis, hot seasons or allergy, steroid will work. But here the concept of fungus, if you have no concept of fungus or superficial mycosis, if you randomly put in a patient on steroid cream, it will what? Fungus loves steroids. And then the lesions become big. Initially you might get relief, but after that you gone. Shesh. So, this is the kind of scenario, and this is a not because having, you have to maintain a personal hygiene, and for the lower economic status, when the persons are not able to maintain that kind of hygiene, so these infections come being repeated. So, if you want to be a dermatologist, so you might get a patient of a several time. Okay. So, aim for a derma. Derma is a very good right now. One patient every season, right? And so, why the concept of fungus is important? Because you daily encounter this. You might not daily encounter Cryptococcus meningitis in daily life. You might not get encounter candidemia in daily life. I have never seen a single case of dimorphic fungi in my life, though it is found in our West Bengal, Ganges, that black dimorphic fungi. But you might get encounter, whatever you may suffer by superficial mycosis. That's why this topic is so important. As you use your daily life, as usual in your clinics, and as usual your viva and theory exam. Superficial mycosis itself come as a long question, itself might come as a short note, and definitely you can be asked in viva. So it will be some small slides, and I made it very scripts. Go through the slides, it enough. Superficial mycosis, it's enough, I said. Okay. So first we'll know regarding types, and then each and every types based lab diagnosis, little bit of treatment part, not that, and preventions is I already told this because this is happening in our lower economic status. So for prevention part, our clean hygiene is maintaining is very important. So what is superficial mycosis? It refers to a fungal infections that affect the outermost layer of the skin and hairs and nails. Unlike the deep-seated systemic fungal infections, the superficial mycosis do not invade the deeper tissue. What is the outermost layer of the skin? Stratum. So they are generally non-inflammatory, though they may cause cosmetic concerns and mild discomfort. So it's just affect your superficial layer, that's it. And what are the types of superficial mycosis? First is the dermatophytes, most important part. Then you have to know little bit of malassezia. Candida is also here. Candida can cause superficial infections, particularly in moist, warm areas of the body. Then the Horti Wernicke, or called also Tinea Nigra, and lastly Piedra Horti and Trichosporum. So these are the 5 types of superficial mycosis you have to know. Jodi short note ashe ba long questions, as per the question number you have to go through the detail. So first is a dermatophytosis. So dermatophytosis also causes tinea infections or ringworm. This is a typically patients came with a ring-like structures. Sometimes it might get spreading to other part of body, and it might getting big with the additions of steroids. So these are the dermatophytes called. This is a dermatophytosis is the clinical name of the condition, dermatophytosis, and or tinea infections. And what are the species? It is the tinea, trichophyton, microsporum and epidermophyton. These are the 3 causative agents under these tinea infections, and they are also called dermatophytes. These are the fungi that infect keratinized tissues including skin, hair, nails. So these infections are called tinea and are classified based on the site of the infections. We will know which sites they called which infections in next slides, and these are the 3 typical causative agent. In trichosphyton, this might be a Trichosporum rubrum, Trichophyton mentargophytes, Trichophyton tonsurans, Microsporum canis, Microsporum odiouni, and Epidermophyton, Epidermophyton flocusum. So these are the 3 causative agent under these tinea infections or dermatophytosis. Now as per the part of the body is infected, we name that tinea. যদি স্ক্যাল্পে হয়, অনেক সময় দেখবে স্ক্যাল্পে এরকম চাকা চাকা লিশনস নিয়ে আসে, প্রত্যেকটাতে ছবি দেখবে, গুগলে সার্চ করবে, ইউ গেট আ ওয়ান্ডারফুল ইমেজেস। আমি প্রত্যেকটা এখানে দিতে পারলাম না কারণ স্লাইডটা আরো বড় হয়ে যেত। তো টিনিয়া ক্যাপিটিস, দিস ইজ এ স্ক্যাল্প রিংওয়ার্ম, কমনলি অ্যাফেক্টেড এরিয়া। আমার কাছে কি একটা ছবি আছে দেখছি। সি দিস ইজ আ টিনিয়া ক্যাপিটিস। Scalp hair follicles are commonly affected. What are the symptoms? Scaly patches, broken hairs, black dot appearance. This is tinea capitis. Another cause tinea corporis, ringworm of the body. Whenever our body get affected, every time you got a kind of this kind of lesion. This is a typical ringworm lesions. This is tinea corporis. You can find it any part of your body, trunk, arm and legs. annular, red, scaly, patchy with central and clearing itching lesions. And what are the typical features of these rings? The central is clear and this is a periphery, it is a reddish in color. So, annular, red, scaly patches with central clearing and you have an itching. Tinea crudis in jock and itch and groin, inner thigh. Tinea pedis affected in foot, feet, also calls athlete's foot because athletes have to having a long time they put their shoes up. So, feet especially between toes. Tinea manuum, palm and fingers. Tinea unguinum, nails and Tinea barbi, beard area in men. So, as per the body area affected, we give this kind of names. And this is Tinea capitis, this is Tinea fisci, this is Tinea pedis and this is a Tinea corporis. And what are the causative agents? 3 causative agents. What are the 3 names? Ki bollam? Trichophyton, Microsporum and Epidermophyton. That's it. Okay, clear সকলের কাছে? So, Tinea is important. Tinea infection or called dermatophytosis. We can classify based on parts of body infected and the causative agents are the 3. That's it. Net pityriasis or Tinea Versicolor. This is Tinea Versicolor. It is a superficial fungal infection that affects the skin pigmentation caused by a yeast-like fungi. Also causative agent, this is called Malassezia furfur. আমরা ছোটবেলাতে ফুরফুর, Malassezia furfur or Malassezia furfur, whatever you want to say. And commonly affected area upper back, chest and neck and arms. And this is the hypopigmented and mucous with fine scaling. Lesions march to form a large particles, mild itching especially in humid conditions, more visible in tan skin. This is all about Malassezia furfur is a causative agent and name of the condition is Tinea Versicolor or Pityriasis. Okay. So, first is a dermatophytosis, second is a Tinea Versicolor or Pityriasis. Now, the Candidiasis. We know the Candidiasis. This is a cutaneous and also the mucosal involvement, a yeast infection affecting skin folds, mucous membrane, nails and often in warm and moist area. And most commonly is a Candida albicans. The skin folds will commonly involve is axilla, groin, inflammatory region, oral cavity. You can get a oral thrush, genital area, vaginal candidiasis. This is commonly we found in women. The itching they have and nails, they say paronychia. This is the commonly superficial mycoses of affected skin by Candida. Okay, this is the types of parts of our body getting involved: skin fold, oral cavity, genital area, and these are very names are that this is skin folds when are getting involved. We commonly we are all called Candidiasis. Oral cavity having special term that is called oral thrush. Genital area when getting involved it is called vaginal candidiasis and nails called paronychia. You have to know this is the very commonly term used. Okay. And symptoms of the oral thrush: white flakes on the tongue which can be scraped off. Innertigo is a red macerated patches in the skin fold with satellite like lesions. Vaginal candidiasis, thick curd like white discharge, itching and burning. And the paronychia is a swollen red nail folds with the pus formations. And this is Tinea Nigra, a rare fungal infections causing pigmented macules on palm and soles. This is Tinea Nigra. This is involved in your palm, and this is the sole. And what are the causative agent? Horty, Wernicke, commonly affected area palms and soles, and symptoms are brown to black, non-scaly macules, asymptomatic, non-itchy, slow growing pigmentation, often mistaken as melanoma. কালো রঙের দেখতে অনেক সময় এটাকে মিসডায়াগনোজড হয় মেলানোমার সাথে, ইটস নন ইচিং, right? So this is about what? Tinea Nigra. What is the agent called? Horty, Wernicke. So we know about dermatophytosis, we know about Tinea Versicolor, we know about Candidiasis, types of Candidiasis of the parts involved, now the Tinea Nigra. And last and is a Piedra. This is a fungal of the hair shaft infections. This is a typically involved in hair shaft. One is black Piedra, one is white Piedra. And causative agent is a Piedra hortei, and this is a Trichosporum species. Common area is a black Piedra, is a scalp hair. Symptoms: hard black nodules attached to hairs, soft and white. Hair, and in white Piedra you getting soft white nodules on the hair. একটাতে black nodules হবে, একটাতে white nodules হবে. This is the two basic difference between black Piedra and white Piedra, but causative agent is also different. Piedra hortei and Trichosporum species, but black Piedra having commonly affected by scalp hair, and white Piedra is bird, moustache and pubic hair. This is a example. This is a kind of nodules seen in hairs. This is a white Piedra. So by summary, just what we have just going through it. First is a dermatophytosis. What are the causative agent? Trichophyton, Microsporum, Epidermophyton. Commonly area: scalp, body, groin, feet. Symptoms: red, scratchy, scaly, itching and nail thickening. It depends upon body involved. It might be a Tinea capitis, Turis, Pedis, whatever. Tinea Versicolor, or what is the another name? Tinea Versicolor. কে বলবে কি ছিল? আর একটা নাম কি ছিল? Pityriasis. What is the causative agent here? Tinea, Malassezia furfur. Upper chest and back, hypo or hyperpigmented patches. ওই যে পিঠের একটা ছবি আমরা দেখেছিলাম, mild scaling. Next, Candidiasis, Candida albicans, skin fold, mouth and genitals. As per involve of the area, genitals, Candida vaginalis. If nail getting involved, we call paronychia. Mouth, gingivitis. Oral thrush, red moist rash, white oral plaques, thick white discharge in vaginal infections. Tinea Nigra or hortei, Wernicke, palms and sole getting dark brown back macules but no symptoms. It is non-itching. Piedra hortei, black and a Trichosporum, scalp, beard, pubic hair getting involved, hard to soft nodules. So this is all the summary of our types of dermatophytosis. Types of superficial mycosis. Okay. Short note এলে এইভাবে লিখবে, long questions এলে এর সাথে diagnosis পার্টটা অল্প অল্প করে জুড়ে দেবে. Now diagnosis, how we diagnose all these cases. Mostly all are basing clinical symptoms. একটা পেশেন্টের যদি ওরকম ring like lesions নিয়ে আসে, we never do a test, যাও একটা KOH করে এসো. But we have to know what are the basic tests, but sometimes bacterial infections or might be superadded autoimmune issues. So we have to differentiate between pure fungal infections with other infections. So we have to know the common test we will do for superficial mycosis, right? So first is the KOH. We all know about KOH. Basic fungus এর টেস্ট গুলো পড়ানো হয়েছে? জেনারেল মাইকোলজি বলে কোনো ক্লাস হয়েছিল? না। হ্যাঁ, হয়েছে তো? টেস্ট বলা হয়েছে তো এগুলো? ল্যাব ডায়াগনোসিস বা টেস্ট গুলো কি কি টেস্ট করা হয়? আরে হ্যাঁ কি না বলবে তো? বলা হয়েছে? কালচার মিডিয়া বলা হয়েছে। যাই হোক আমি একটা সামারি করে দিচ্ছি কি কি কমনলি টেস্ট করা হয়। ফার্স্ট মোস্ট ইম্পর্টেন্ট ইজ ফাঙ্গাস ইজ এ KOH and mostly কি করা হয় 10 to 20% KOH, 10% KOH for normal skin and for hair dissolve for 10 to 20 minutes or half an hour, and for nail infection if you have a sample of a paranoia nail infections you have to give a 20% KOH and overnight incubation. KOH 20% এ নেলটা দিয়ে রেখে দিতে হবে কারণ নেলের কেরাটিনটা ডিসলভ না হলে ফাঙ্গাল মেটেরিয়াল বাইরে বেরোবে না। Got my point? So KOH is the first and foremost important identifications of a fungus, specifically in respect to superficial mycoses. কারণ এটা করতে 2 মিনিট টাইম লাগে, তুমি ফাঙ্গাল এলিমেন্ট দেখলে ব্যাস ডান, আমি এবারে ওষুধ দেবো। এবার তোমার ট্রাইকোস্পোরান আছে কি মাইক্রোফাইটন আছে কি এপিডার্মোফাইটন ডাজন্ট ম্যাটার ফর ওকে জানার জন্য এপিডেমোলজিক্যাল পারপাস অর হোয়াট এভার, but initially you want to know it is a fungus or not. For KOH it just need a proper technician, well-known technician or whatever microbiologist to identify the fungal element is present or not, and it's very easy. Okay, so first is a KOH, second is a wood lamp examinations, not commonly used because KOH দিয়ে maximum কাজ হয়ে যায়, but you have to know where KOH wood lamp examinations have been done. So UV light helps to detect fluorescent fungi, some fungi fluoros, ঠিক আছে, ফ্লুরোসেন্ট মাইক্রোস্কোপের তলায় তারা একটা আলাদা ফ্লুরোসেন্স দেয়, this is a microsporum SP, blue green and Malassezia SP, and some used for Tinea capitis, Tinea Versicolor and white Piedra. So এই ক্ষেত্রে আমরা wood lamp examination use করি। নেক্সট ফাঙ্গাল কালচার, SDA তে জেনারেলি কমন মিডিয়া ইজ SDA, গোল্ড স্ট্যান্ডার্ড ফর আইডেন্টিফাই ফাঙ্গাল স্পিসিস আইডেন্টিফাইফিকেশনের জন্য আমাদের SDA মিডিয়া লাগে। Dermatophytes, Candida, Trichosporon and others grow within days to week in SDA. This is SDA, how it looks. This is a Trichophyton mentagrophyte, this is Microsporum canis and Epidermophyton. So SDA তে আমাদের গ্রো করে আফটার দ্যাট হোয়াট উইল ডু আ ল্যাক্টোফেনল কটন ব্লু LCB মাউন্ট করা হয়। দিস ইজ এ ল্যাক্টোফেনল কটন ব্লু, এখান থেকে ফাঙ্গাল এলিমেন্টটা নিয়ে একটা কভার স্লিপে ল্যাক্টোফেনল কটন ব্লু দিয়ে উইল সি দ্য প্যাটার্ন অফ গ্রোথ, কি কনিডিয়া আছে কি রকম দেখতে, উইল সি দ্য পিকচার্স অ্যান্ড বাই under microscope seeing the different types of conidia we differentiate the species, konta epidermophyton konta trichosporon. Got my point? So first the samples comes, we will do what? KOH. After KOH the samples put on SDA agar, SDA agar e এক সপ্তাহ পরে গ্রোথ আসে, এরকম গ্রোথ আসার পরে then for speciations we will do what? LCB mount, lactophenol cotton blue, lactophenol cotton blue তে দিয়ে কভার স্লিপের আন্ডারে মাইক্রোস্কোপে দেখা হয় স্পিসিয়েশন, কোনটা ট্রাইকোফাইটন কোনটা এপিডার্মোফাইটন কোনটা মাইক্রোস্পোরন, whatever the different types of dermatophytes we can see under lactophenol cotton blue mount. Another gram stain we can do specifically for Candida infections, যেখানে আমরা ক্যান্ডিডা করছি, we have also see LCB staining, enhanced fungal structure under the microscope used in dermatophyte and Piedra diagnosis. The difference between KOH and LCB, key KOH is a basic test, day 1 test, just to know that fungal element present or not, but after having a growth on SDA media and again see from fungal element from SDA media under microscope via lactophenol cotton blue mount stain, we can differentiate species. KOH দিয়ে আমরা ডিফারেন্সিয়েট করতে পারবো না ডার্মাটোফাইটস এর কোনটা ইনফেকশনস আছে, which type of infections, it is a trichophyton or it is a epidermophyton, we can't differentiate the species, but here we can say by LCB, okay, this is epidermophyton, this is a omuk, this is tomuk, XYZ. Got my point? What is the difference between KOH and LCB? দুটো কখন করা হয়, একটা ডে 1 এ করা হয় আর একটা ডে 7 এ করা হয় আফটার হ্যাভিং গ্রোথ। গ্রোথ যদি না আসে তাহলে there is no scope to do LCB mount. And some periodic acid-Schiff or Gomori Methenamine stain, this is for histopathological stain to detect fungi in tissue. কিছু কিছু biopsy material এ fungus থাকতে পারে, involvement হতে পারে, there we can do this kind of stain for. So these are the 6 commonly stain. Another is a PCR. PCR is everywhere. পৃথিবীর সব কিছু PCR এ diagnosis করা যায়, but these are the common 6 methods we are commonly applied, but the main are the 3. One is KOH followed by a HDA media culture media growth followed by LCB, Lactophenol Cotton Blue, and this is typically applied for what? Superficial mycoses. তোমার যদি এটা ব্লাডে ক্যান্ডিডা থাকে, ক্যান্ডিডিমিয়া যদি আমি আজকে আইডেন্টিফাই করি, সেখানে আমি KOH করব না। KOH for only where the keratin material is present, for dissolve the keratin material that might thus affecting skin and hair and nail. So only for superficial mycoses these are KOH and all those are important. But for the candidemia, if you are suspecting patient is suffering for blood infections by candida, then you have to do what? You have to do blood culture. If you are suspecting a patient for a cryptococcus meningitis, then you have to do what? CSF culture or CSF PCR or CSF whatever other tests. But these are typically applied for superficial mycosis, and KOH is barbar ekta kotha repeated bolchi, KOH is important for where keratin material is present or not, right? So this is how it looks under LCB mount. This is Trichophyton. প্রত্যেকটা আলাদা না দেখতে, বেশ সুন্দর না দেখতে? ফাঙ্গাস ইজ ভেরি ইন্টারেস্টিং। ইন মাই পিজি ডেজ আমরা বই খুলে বসে থাকতাম আর মেলাতাম কোনটার সাথে কনিডিয়াটা মিলছে। এইটা দিস ইজ ট্রাইকোফাইটন, দিস ইজ ট্রাইকোফাইটন রুব্রাম, দিস ইজ এই, দিস ইজ ওই, নিয়ে স্যারদের বলতাম স্যার দেখুন এইটা পেয়েছি। Clinicians are least bothered. They know this is a fungus. I will do a itraconazole or fluconazole, whatever. Okay, but during the PG days, we have been very excited in the identification of fungus. First, fungus are little bit least, not that kind of having focus to every lab, because that needs expertise. That need more media support and more expertise technicians. So 99% lab doesn't having a facility to identify fungus, okay, because of the lack of expertise. So these are the microscopic appearance of the various dermatophyte infections. This is a Trichophyton, Microsporum and Epidermophyton. This is a Trichophyton mentagrophytes. This is Microsporum canis and this is Epidermophyton flucosum. Okay, this is a under LCB mount. You can see the different conidia. This is called conidia. এই conidia গুলো দেখেই আমরা আইডেন্টিফাই করতে পারি। See, this is a kind of identification features of Trichophyton mentagrophyte. আগের এটা একটা schematic diagram, and this is a Microsporum canis. See, Trichophyton এটার সাথে এই যে পিকচারটা দেখছো এটাই এখানে দেওয়া আছে, এই যে পিকচারটা দেখছো এটাই পরবর্তীকালে দেওয়া আছে, রাইট? দিস ইজ এ Trichophyton, দিস ইজ এ Microsporum, একটা বর্ষার ফলার মতো সেফ, and this is a kind of different special types of hyphae seen in various dermatophytes. Now if you go through the types by diagnosis part, ঠিক আছে, প্রত্যেকটা টাইপসে আমরা কি রকম কি পাবো জাস্ট শর্টে দেওয়া আছে। So first is a Tinea infection, and by first is what I said, that clinical examination is very important. So you will get a annular scaly erythematous patches with central clearing lesions. So you might in your head, then okay fine, this is a case of Tinea. And Tinea, what are the 3 agents? Bolo? Microsporum, Trichophyton, Epidermophyton. তাহলে very good. Then see তাহলে কি হবে, তাহলে ফার্স্টে কি করব আমরা, we see KOH, scrap skin here for nail at 10 to 20% KOH and observes under a microscope. তাহলে কি পাবো, septate branching hyphae বা স্প্যাগেটির মতো এরকম ছোট কি দেখতে পাবো KOH এর, ঠিক আছে। দেন উই ক্যান ডু উডস ল্যাম্পস, সাইন ইন উড ল্যাম্পস যারা হচ্ছে ফ্লুরোসেন্স দেবে, মাইক্রোস্পোরাম স্পেসিস ফ্লুরুস ব্লু গ্রিন, জেনারেলি এটা করা হয় না বাট পরীক্ষার খাতায় এটা লিখতে হবে। Then SDA, fungal culture, inoculate sample on SDA media and incubate for 7 to 10 days and we can see Trichophyton, Microsporum, Epidermophyton colonies যে ছবিগুলো দেখানো হলো। Histopathological stain used for severe case of nail involvement, ঠিক আছে। Fungal element visible inside keratinized tissue and PCR based molecular diagnosis, direct detected fungal DNA identifications, confirm dermatophyte species. So these are the basic tests. Hypopigmented or hyperpigmented macules যেটা আমরা ওই পিঠের ছবিটা দেখেছি, with fine scaling, lesions become more prominent in sunlight exposure and mild itching in humid environments. এখানে আমরা কি পাচ্ছি, KOH mount 10% KOH with scrappy scaly mixed with examine under microscope. এখানে একটা টিপিক্যাল আমরা পিকচার পাবো, কি পাবো, স্প্যাগেটি মিটবল অ্যাপিয়ারেন্স। আগেরটা কি ছিল, শুধু স্প্যাগেটি। স্প্যাগেটি মানে তোমরা যখন মোল্ড ইন দেখবে লম্বা লম্বা ট্রাম ট্যাকের মতো অ্যাপিয়ারেন্স ইন KOH, resembles like spaghetti, but here we have also having some meatballs, golla structure, so there, that's why it is called spaghetti meatball appearance. So here is a spaghetti and this is a kind of meatball, okay, this is a spaghetti meatball appearance. Wood lamps, signs wood lamps on affected area, yellow and golden fluorescence. Fungal culture, incubate at 30 degrees centigrade, since Malassezia is a lipid dependent, yeast like colonies is there, and we can do also dermoscopy, non invasive skin examination, budding yeast and high field structure. See, যদি এত কিছু যদি নাও মনে রাখতে পারো, শুধু মনে রাখবে KOH টা, dermatophytosis infection, KOH is very important. Then আমার SDA তে কি পাচ্ছি, ওকে। Now diagnosis of cutaneous and mucosal candidiasis, oral thrush, intrigo-vaginal candidiasis or paronychia. So KOH mount 10% KOH with calcophore white stain, collect skin, nails on mucosal scraping mixed with KOH, observe under a microscope. Budding itself with pseudohyphae. ক্যান্ডিডার ক্ষেত্রে সেটা গ্রাম স্টেন হোক or KOH হোক, every time you will get this feature. কি ফিচার, budding yeast with pseudohyphae. Candida is a true yeast or yeast like? Candida is a true yeast or yeast like? আমি চারটে বললাম তো ফাঙ্গাস আছে, yeast, yeast like, mold and dimorphic. Candida কোটার মধ্যে পড়ছে, কোনটার মধ্যে, হ্যাঁ, না, yeast like. কেন yeast like? Because Candida having a pseudohyphae, those are properly yeast. যেমন what? Example, Cryptococcus doesn't produce pseudohyphae. Got my point? তো গ্রাম স্টেনও তোমরা একই পাবে, গ্রাম পজিটিভ বার্ডিং ইস্ট, ঠিক আছে। ফাঙ্গাল কালচার ক্যান ডু SDA or chrome agar. Candida albicans appear in green or chrome agar. Chrome agarটা কিছুই না, একটা কালচার মিডিয়া স্পেসিফিক্যালি ফর ক্যান্ডিডা, যেখানে ক্যান্ডিডাটা দেখতে একটু কালার দেবে, দ্যাটস ইট। Tinea Nigra, brown or black macules usually on palm and soles, painless, slowly enlarging, often misdiagnosed with melanoma. এখানে আমরা কি পাবো, KOH মাউন্টে scrap lesions, treat with KOH, observed under a microscope, brown septate branching hyphae. And fungal culture SDA তে black slow growing fungal colonies. Okay, so this is all about diagnosis, and You have to know about treatment. Terbinafine and itraconazole are commonly used. Also, you can any kind of azoles. Also, you can use fluconazole. Duration depend on the affected site. 1 to 2 weeks for clean lesions, 6 weeks for hair infections, and 3 months for onychomycosis. And alternative oral griseofulvin or ketoconazole, and topical lesions is a commonly used luliconazole, white feed ointment or tonlafate. So these are the treatment part. Treatment part tomader onekta otota important noy, but if you summary it, what are the types of infections and তাদের হচ্ছে basically diagnosis. Diagnosis এ যেগুলো point আছে, just you have to remember mainly KOH and SDA. Types কি হলো, first এ dermatophytosis. Dermatophytosis having a various parts of body infected, Tinea infections we commonly called. এর কি causative agent আছে, trichophyton, epidermophyton, microsporum. আমরা KOH এ কি দেখবো, spaghetti like or trumptac appearance শুধু পাবো, and SDA media there is a growth of fungus, and then we will do LPCB, Lactophenol Cotton Blue mount. Then comes what, Pityriasis, what, Tinea, Pityriasis or Tinea Versicolor, তাই তো, Tinea Versicolor black এ non-scaly itchings like lesions, and by diagnosis আমরা কি করছি, KOH এ কি পাচ্ছি, KOH finding spaghetti and meatball appearance, that's it. Then তারপরে কি, Candida, Candidiasis, oral candidiasis, vaginal candidiasis, oral candidiasis called oral thrush, এইগুলো আমরা জানতে হবে. Candida is a what kind of yeast? Yeast like. Yeast like মানে ক্যান্ডিডাতে, পৃথিবীর সব ক্যান্ডিডাতে একটাই pseudo hyphae, budding yeast with pseudo hyphae. কি KOH কি আমার gram stain. Candida can be identified also gram stain, remember that. And then chrome agar, Candida chrome agar or SDA, chrome agar it appears blue. Then what, Nigra, Tinea Nigra, Tinea Nigra কোথায়, black palm and soles, black color, black to brown, non itching, confused with melanoma. And lastly Piedra, Piedra তে আমার কি আছে, white and black Piedra. একটা হচ্ছে কি পজিটিভ এজেন্ট দুটো, ব্ল্যাক পিয়েড্রা কি ছিল, ম্যালেসিজিয়া ফুরফুর, তো স্প্যাগেটি মিট বলে চলে গেল টিনিয়া ভেসিকুলার, ওখানে তুই ম্যালেসিজিয়া ফুরফুর এখানে কেন আনছিস, হ্যাঁ কি, হ্যাঁ আর একটা ট্রাইকোস্পোরা, ঠিক আছে, তো দুজ আর ব্ল্যাক পিয়েড্রা আর একটা হোয়াইট পিয়েড্রা, দ্যাটস ইট. দিস ইজ অল অ্যাবাউট superficial mycosis, ठीक है, but it is important, and dermatophytosis is very important. Dermatophytosis itself can cause as a short note.